Southwestern for, I'm having an MRI at 9:10, and then I'm meeting with the neuro oncologist at 1, and then at 3 we're going to go down to Cedar Hill for a meeting with Dr. Patel in Cedar Hill. So I'm hoping that I'll get to see the images today from the MRI today. I'm assuming that they're going to send them over to the neuro-oncologist. I'm going to ask them to email them to me, because the last time I just had to take pictures of a computer screen. So I have Dustin with me, and Phineas, and Elia might be asleep. Elia, are you awake? Yeah. Can you say hi?
To the phone.
And Asher, are you awake? Oh, Asher's sleeping. That must be nice. Alright, so I will share an update when all this is over. Alea, why don't you sit next to Finn?
Sit in the chair. Sit in the chair. Look, it's double wide.
Why is it so big?
It's for fat people.
Is it really?
Seriously, yeah, this is America. Look, this is the normal seat right here, and then right here is double the size.
And then you share a seat with Finn.
Fine.
I'm afraid.
Get your stuff up there.
I'm afraid though. I need to share.
And
My kids are eating my food, which I was given because
I knew that was gonna happen.
my blood pressure is a little low, I guess.
Go.
96 over 68. They almost didn't let me leave the, or they wouldn't let me leave the other place till my blood pressure went up a little.
You'll get your juice.
I feel fine though. You gonna eat some snacks, Dustin? No? Alright, I'm gonna enjoy my cranberry juice and my pretzels.
I want some.
No.
You want my pretzels? They're stealing all my stuff. Go away.
Early in the 2020s, found to have the brain tumor, had surgery with Dr. Turner back in 2022, and then haven't really had any radiation or chemo, is that correct?
Right.
Okay. I want to take you on a tour of your brain back in time. So I'll put up the oldest scans that I have. This is from April 30th, 2022.
29th.
Or 29th.
Does it say 30th?
It says 30th on there.
Oh.
Maybe it was late at
If
night.
it's the one I think, it would have been. Well, I don't know. I'm sure they did some MRIs in the hospital, and I just don't remember.
This is the scan with the contrast at the time. So tumor was right here.
There she is.
It was this white stuff at the very, very top, on the left frontal lobe. It was a large tumor. It was pushing down on your ventricles, so these guys were a little bit depressed with the mass effect. This is the scan without the contrast. I'll put that right next door. And this shows the same thing. The tumor is there, and then all these small little things on the side. That's the swelling from the tumor.
Okay.
So you got lucky. You had Dr. Turner. He's a fantastic surgeon. Did a great job. This is the same two sequences. This is May 7th. So you can tell this is after surgery. There's your staples that were on the top. When you go through, he went and he pulled basically everything out. Made a giant divot kind of sitting there, and he pulled everything that looked like tumor from the inside of the brain. He still had a little bit of stuff left over, some of this white stuff towards the inside. Whether it's tumor or whether it's just from the swelling that had been there for so long, hard to tell based off this one MRI in May. But he did do another MRI. This was 5 months later. It was in October. This is what that one looked like. This is the contrast, and then this is the flare. All the staples had been removed at this point. Nothing took up the contrast. That whole cavity was nice and empty after Dr. Turner did his job. And then when you look at the scan without the contrast, you can tell a lot of that stuff had resolved. You just had the typical kind of post-surgery scar tissue that we normally see. When you flash forward, this is, you had one in October of this year, and then you have one from today. The one today didn't get contrast. Apparently the IV infiltrated or something. This is what the scan today looks like. There's all this extra white stuff that's right around the edge of the cavity, something over there, and then this part that's a little deeper to the cavity. And then this guy towards the top. It doesn't look crazy different compared to May. Like there's no new spots. But if we put these side by side, and you see kind of how it looks, you are having some growth since May.
Is there?
Just a little bit.
Okay.
So March 20th is over here on the left side, and then today is over here on the right side. These are both the scans without the contrast, so we can compare apples to apples. There we go. So it should be around the same size. And what you're seeing is this looks a little thicker. This guy over here on the edge is a little bigger. If you measured this, this is measuring about 16 millimeters, or about 1.6 centimeters. This was measuring about 11, so it's about half centimeter larger. And then this stuff in the middle, this is going into this ventricle over here. This has also gotten a little bit larger. This thing towards the top, this has also gotten a little bit larger. Not like a new spot, like I said, but still larger than where you were just back 5 months ago. In terms of contrast, like I said, you weren't able to get contrast, adequate contrast for this one, but on the one back in March, when you look at it, there was some contrast uptake in there. It was this part down here, which corresponds to this area, and then this guy up here, which corresponds to this. So the two parts that look the most aggressive of what's there are the parts that are the most aggressive. That's why they take up contrast. And I saw that you saw Dr. Patel before you saw me, and she offered you surgery. What do you think about that?
I mean, like I was telling him, I'm not opposed to it completely. I just, the idea of doing another brain surgery makes me a little bit nervous because the first one went so well, and I mean, it's brain surgery.
Yeah.
You know? So.
It's like pressing your luck or something.
Yeah,
You only
right.
have one.
Yeah.
Because I didn't have any kind of, I don't know if you would call them symptoms or side effects or what they deficits. That's what they called them after. I had nothing. I had a little bit of stuttering. That was it.
Okay.
And so I just worry that maybe I'll have all the things this time, you know?
No, you should be fine. Based on that location, the fact that this is all on areas that are bordering what's already been accessed by Dr. Turner, you should actually be fine in terms of getting that out of there. Even if she can't get every possible thing, if she can get the stuff that takes the contrast out, then I think you could avoid, radiation and chemotherapy, and I can give you targeted therapy, vorasidenib. If you take out all of the enhancing stuff, then you actually will respond to the drug. Vorasidenib is an IDH inhibitor. Your tumor has an IDH1 mutation. All that would mean for you is you take a drug every single day for the rest of your life. It'll work for quite a while. It won't work forever if you are just the average person statistically, but it should work for quite a while, and then you'll be older when you get radiation and chemo, if that's what you decide to do, and you'll end up you'll tolerate it a whole lot better.
Okay.
If you decided, I don't want any surgery, it's radiation and chemo. That's the treatment right now.
Right.
Grade 3 oligodendrogliomas, which is what this was graded at, you would do radiation and chemo together, and then you'd follow that with chemotherapy by itself. We have a couple of choices for the chemo. You can do the tried and true regimen, which is a 2-drug regimen, or you can do one that we commonly do. It's a drug called temozolomide. You can do that instead. Both of them are very well tolerated. The good thing about brain tumors is people generally tolerate the treatment without much issue at all. From a radiation standpoint, you lose some hair over the areas. This is left frontal, kind of where your surgery was. You'd lose hair up here. It would come back in 3 months. From a chemo perspective, nausea, constipation, fatigue, and then it could drop your blood counts, and we check your labs frequently. If you do get surgery and we're able to avoid radiation and chemo up front, like I said, I would use a drug called vorasidenib. It's very easy to tolerate. There's one side effect. 9% of patients who take it get elevated liver enzymes. So 91% have nothing, and so they're fine. And like I said, the only thing that you need to qualify that is to make sure you have no contrast enhancing disease on your MRI. It's FDA approved for grade 2 disease, but as long as all the grade 3 disease is physically removed, meaning all the contrast enhancement is gone, you should respond just nicely to the vorasidenib.
Is that the same thing as Veranigo?
Yep.
It's just a different
Same
name
thing.
for it. Okay.
Yeah.
All right. The other thing I was reading about that is that it comes with quite a bit of fatigue. Is that right?
The Veranigo? Not really. It's
No?
generally well tolerated.
Okay.
I'm the #1 prescriber in the country, so
Oh,
I
wow.
probably have the most experience.
Okay.
The second highest person here, or second highest person is actually also, she works here.
Okay.
So as an institution, we have the most experience with the drug by far.
Okay.
Fatigue is not something that patients complain about
Really?
very often.
I'm on a Facebook page, and I always go to Reddit to read what real people are saying that have taken, and everybody. I don't think I saw one that didn't say, "Oh, the fatigue," and I'm already abnormally tired.
Yeah.
Like napping in the middle of the day doesn't affect my sleep at night, you know. And so when I read that, I was like, so I'm just gonna sleep all day if I take that pill, you know.
That's never been an issue for any of our
Okay.
patients. That people go online and tell what their experience usually have a negative experience. It's like you buy a car and it's terrible. You write about it online. You don't write about how great it is.
Yeah.
I usually, if you do end up getting any of those types of side effects, usually I see that with more in the radiation and chemo side of things.
Okay.
I'll give you a stimulant medication. Should help.
Okay.
Kind of it's like drinking a strong cup of coffee.
Okay.
So you get the energy.
Okay. All right. Okay. Well then, I would say, I would lean hardest towards surgery, which is, I don't want to have to do any of this. You know, like I was telling him, none of this sounds good. But if I had to pick, I would go anything that I can avoid the chemo and radiation. So, yeah.
Okay.
I think I would probably
Makes
do
sense.
that.
What's this I hear about ivermectin and mebendazole? How long have you been doing
Fenbendazole.
Fenbendazole?
And I just told him, I just saw the other day that it's menbendazole that penetrates the blood-brain barrier, and it said, so if you have brain tumors, you're supposed to be taking menbendazole. And I was like, oh, well, I've been taking fenbendazole since March.
Okay.
So,
I mean, you've had progression since then. I think it's clear that it's not working.
Yeah.
I'll tell you now, if you're on it, I can't prescribe you not the ivermectin. If you're on it, I can't prescribe you the Verenigo.
Okay.
Because it does go through your liver, and the 9% of patients who do have liver enzyme elevation, they were on some sort of drug that goes through the liver, not necessarily ivermectin or fenbendazole or mebendazole. I've had one person try to do it at the same time, and they shot up. She ended up getting drug-induced liver injury on a liver biopsy. So you'd have to commit to coming off those if you're going to do the Verenigo.
Okay.
So,
Okay. All right. Okay.
What kind of questions you got for me?
I don't really have any questions. I mean, you answered, my main question was coming in to see, is it possible to avoid chemo and radiation? And when I met with Dr. Patel, she said, when you meet with what's your last name? Youseff. When you meet with him, you can ask him if you have to do surgery or if you could just go straight to the pill, but you just explain the whole contrast thing. So, that was my main question. So.
Yeah. I wish it worked on the enhancing disease, because then you could avoid surgery altogether. But we know from our experience that if I just gave you the drug today and you took it, it's not going to do anything. Yeah,
right.
your next MRI in 2 months is going to show that it's bigger.
Okay.
So, there wouldn't be a reason.
I guess I do have one question, and I know you're not a neurosurgeon, but like this right here, that's in my brain, on my brain. So when she goes to remove that, is it going to?
Yeah, so it's pressing against the
It's just pressing against it. Okay.
But it is, all of this is in your brain.
Okay.
And so when she goes in, she's going to probably use the same incision that you had before. And then she'll go in and she'll just basically ice cream scooper this out on the one in the middle, the one on the edge over here, and then this guy up towards the top. She'll just kind of scoop it all and take out as much of it as she can.
Okay.
As long as she's, like I said, able to get the core of this where you have contrast uptake, and then the core of this where you have the contrast uptake, you should be fine.
Okay.
And that stuff should be, when she goes in there, like I said, like you said, I'm not a surgeon. But when she opens your brain and she looks at it, this should be readily apparent that it's tumor. And as long as she takes everything that looks like tumor, that's the higher grade stuff. Anything else she leaves behind should be able to be treated appropriately by the IDH inhibitor.
Okay. Okay. Will the pictures from today's scan go onto my chart? They said that would. Okay.
There's a link. So when you go open your when you go in your My Chart, you'll see under test results. There'll be a link that says show images. And you just click on it. This one that you're looking at, it's going to be called the T2 flare. That's this one where it lights things up in white. The other sequences all look at different stuff. Like these look for strokes. This looks for structure. This looks for perfusion, and I don't think because you didn't get the contrast, this is not even a valid perfusion imaging scan. These last two, you're really just looking at this.
Are all the images under my images, or just the ones from today?
All of them will be in there.
Oh, good. Okay.
Yeah. If you do it on a computer, you can do the same thing we did here.
They sent me a disc with all my images from Midtown that I've had over the years, and we could not pull it up on anything. We tried.
Yeah, that's all. But
Oh, good.
Yeah.
That'll be good. I was taking pictures of the computer when I was with Dr. Patel, and I was like, this is not what I wanted.
Oh, no. Yeah,
So-
now that you had both scans, or had a scan here, all of these will show up in your MyChart.
Okay, good. All right.
Yeah.
Okay.
Cool. Do you want me to tell Dr. Patel you're interested
Sure.
in surgery? Okay.
Yeah.
I'll let her know today.
Because I'm curious to know how soon she would want to do it.
Okay.
You know, because I remember for at least the first month, I was pretty immobile. I mean, just like in bed a lot, you
Yeah.
know, and so I'd want to.
Try and push
Probably-
yourself as hard as you can when you're in recovery this time.
Okay.
Those are the folks that usually don't have as much trouble. Is like, you know, the day after surgery, you're up and you're walking around the hallways in
Yeah.
the hospital.
And
When
I
you go home,
was.
same thing. Like you're
Yeah.
pushing yourself. You're not sleeping all the time. You'll
Yeah.
do much better. long
Okay.
term. So
Yeah, no, I just remember being up, like I'd try to be up. I mean, he'll tell you, and I could be up for like 5 minutes, and I'd be like, I gotta sit down.
Yeah.
I would get really, really tired just for like first month. That's what I mean.
But
If
I
I'm
think
gonna
it's
do the
also gonna be
surgery,
a different situation this time versus the first time.
I
'Cause
don't see how
that
it's
was
brain surgery.
It's brain surgery, yes, but there was more that was removed. It was a longer surgery. I don't know. It just
It
seems
wasn't a
like,
very long surgery though.
well, it just seems to me that the recovery time would be
Yeah, I guess.
somewhat less anyway.
He got that big tumor out in 2 hours.
Oh, really?
He thought it was gonna take like
Impressive.
way, way longer,
Well,
and it only took 2
he
hours.
said 5 to 8 hours.
Yeah.